We're good? Okay, so we're going to go ahead and get started. I'm here today with James Maskell of Evolution of Medicine and Functional Forum and the New Tour, which is something that we're really excited about. He will be coming with his bus to North Carolina. There will be an event in Raleigh and another event in Charlotte. And we want to talk a little bit about what the event is and why we want to participate and how we can really help to promote functional medicine in our area. So I'm going to let you start talking about it, and then we want your questions.
Hey, don't forget Seth Conger is right here too. So we've got the full North Carolina posse here with us in San Diego. So greetings, and hey, thanks so much for making time to be here this evening. I want to just take 5 or 10 minutes to talk about, what the New Tour is, what New Health is, and, ultimately just answer any questions that you have so you guys can feel good about being part of it. So, as you probably know, if you've been sort of following what we've been doing, we've been in a process of building structures that can transform healthcare. I mean, that's really what we're interested in. And my partner and I in 2013 saw that, recognized that there's a sort of convergence of functional medicine, community, and technology that was going to be the future of healthcare. And so, we started out basically phase one of a plan to transform. And phase one of the plan was, we need way more doctors doing functional medicine. That was the starting point. That was the starting thesis for phase one. So what do? You make content that had been previously only available behind a firewall. You have to come to a hotel like this and listen in. You put it online for free, right? So we have the Functional Forum started. You create meetup groups so that doctors can get together and be confident, share connection, and help each other develop the confidence that it takes to do this every day, right? I know that amongst the practitioners who've been doing functional medicine for a long time, you have many arrows in your back from other doctors, from the medical boards, from everything that it took to be sort of like ahead of the curve. And so, what we've seen time and time again is that doctors have told us that they feel a confidence to transform their practice towards functional medicine from being in a community of other doctors that think like them, so they can validate their experience in the clinic. And we look to also make it easier for doctors to start functional medicine practices. So my book was really focused on the micro practice. How do you start a functional medicine practice on the side so that it's, so that you can start to build the practice of your dreams and get out of your day job? And how do you do that? And we started a whole business basically. So that was phase one, because we realized that there was not nearly enough doctors and providers ready to make any sort of impact on a big enough scale. So we've been doing that for about 4.5 years. So the question that we asked at the beginning of the Functional Forum that I thought that no one else was asking was, if we suddenly realized we needed 100,000 doctors doing functional medicine, what would we do? Right? And we would do what we did, I think. We would partner with organizations that did it, bring down the cost of learning about it, make it easier for doctors to find out about it, create communities of doctors to help reinforce that. So then about 1.5 years ago, I realized that we need to start asking a new question, which is, if we wanted to deliver functional medicine to, let's say, a population of 100,000, let's say in an employer, how would we do that? Right? How would you do that? Because here's one thing about functional medicine that I hope you guys will agree with, and I'm ready to be wrong if you don't agree, but I've been asking these kind of questions on the tour all across the country. Think about the unicornness of a patient that makes it to functional medicine clinic, right? In order to make it to a clinic where you're paying cash pay functional medicine, you have to, 1, not like the care you're getting elsewhere. 2, start researching that there's another option. 3, find a local provider who does it. 4, book and pay for an appointment and the ongoing appointments that it takes, right? Those are 5 steps that most people are not going to do. And so what we've ended up with is a situation where, you guys are treating it, depending on the practice makeup, but a lot of like really chronically ill people, super chronically ill people. And ultimately, when you look at a pool of 100,000 people, they're not all chronically ill. You have some that are healthy, you have some that are super severely chronically ill, and then there's this middle band, right? There's this middle band of patients that are, you know, on the route towards getting chronically ill. You know, they're not eating well, they're taking over-the-counter medications, they've got a lot of symptoms, they're managing it in different ways. They're not on like expensive biologicals or like complex medication, but left to their own devices, they're heading into this lower tier. But if they get the intervention from not even a functional medicine doctor, from a health coach or from a nutritionist or from any other type of provider, they can make it back into tier 1, into healthy. So essentially, you know, that was our thesis, was that there's these 3 tiers and we need to deliver the appropriate care to the appropriate tier. And that tier 3 needs functional medicine, tier 2 needs basically lifestyle intervention. I mean, what we've seen from following the most successful functional medicine practices is that really the functional medicine doctor today is really doing 2 separate things: root cause diagnostics, right, and lifestyle intervention. And these are lifestyle execution, helping patients execute healthy lifestyle. These 2 things are actually separate and could be, you know, could and possibly should be done by different people, because a health coach can do it for, you know, 1/10 of the cost of a doctor. And there's 10 times more health coaches than there are functional doctors. So we were looking at scale. How do we get scale? How do we treat a lot of people? So last year we started to do a pilot, which is essentially, could we take these tier 2 people, not the tier 3, and could we get them back to healthy without a doctor, with just having, you know, health coach and other practitioners, so that we could save the functional doctors for the tier 3, because there's a ton of them too. They're everywhere. And so we were just like, what's the appropriate care for the right number of people? And by the end of last year, we had sort of, you know, shown through our pilot that we, you know, that was a good idea, that by helping people who were not severely chronically ill, who are not on lots of different drugs, that if you just help them with the lifestyle delivery and if you empowered them with their own health data, you could get a large percentage of them to move in the right direction towards health. And so then we were like, okay, what are we going to do now? How do we deliver this care? Are we just going to charge cash to the population and be in competition with all of the other providers that we've spent the last 4 years diligently nurturing? Or is there a way for us to is there a way for us to simultaneously make this kind of care more available for more people, and to make referrals to our functional medicine doctor community in a way that they get paid in the way that they like to get paid, which is cash, right? Not having to wait for the insurance thing. So we were just sort of working that out, thinking we did get an employer contract where we started to work with like an employer group, and that's going pretty well, although I'm like out of the process, you know, it's selling employers things is hard, and I've never done it before, so I'm just sort of making my way through understanding it. And ultimately, like, I'm not really responsible for the sale. I can introduce them to the company, but I can't do anything. So then on January 2nd, something changed. And that was a big moment, and it's something that I've been following for the last 4 years, because if you've been following me, you know, in 2015, I did a summit called the Evolution of Medicine Summit 2, and instead of having sponsors, we sort of sold this idea of a Christian health cost sharing ministry. And I don't know how much everyone knows about this, but I'm just going to give a 2-minute overview. So starting in like earlier in the last century, but starting to be a bit more popular in the 80s, church groups started to sort of come together to share their healthcare costs in a very rudimentary fashion, like people sending checks to each other every month. And an industry grew up around that. And so in 2010, there were 150,000 people in the country that were using these groups. And then something happened that was significant. They got an exemption to the ACA law, the individual mandate. So if you were part of one of these groups, you didn't have to have health insurance. And so they, you know, and it grew spectacularly to 1 million people as of January 2018 use these groups. And they control costs in very interesting ways. The way that they control costs is that friends don't let friends pay full price for healthcare. They don't let them pay retail. So they get the lowest price on labs. You know, if you break your arm, rather than walking in with your insurance card and getting the full price, they will negotiate for cash with the emergency department for all the services and get like a bundle of care. And they typically get 40 to 60% off. Also, they have a very sophisticated back-end system where they can see whether the charges are eligible for city, state, or federal grants, and about a third of all medical bills are. So, you know, these organizations grew with a structure all dedicated to reducing costs within the pool and keeping the costs low for the users. And, you know, there's some quite sophisticated companies now that support these Christian ministries. So on January 2nd, the law changed. And on that day, what happened was the Trump tax bill got rid of the individual mandate. And what that meant was that people didn't have to buy health insurance under tax penalty anymore, regular people, not employer people, but just individuals. And that was the moment when I realized, like, this was the way to get functional medicine to a lot more people. Because if we only have to wait until people get really chronically ill to then try and get them to learn something and siphon them into a cash pay practice that's all sitting on top of an insurance system that they're not using, the growth will be as it has been in the last few years, which is okay, you know, not great, but, you know, happening because the only people that ever show up are like super desperate or super wealthy or super green. So my thesis is that how we get from 5% uptake of functional medicine to 50% uptake is that rather than trying to convince this next 45% that it's better, you know, when you say the words functional medicine or holistic medicine or integrative medicine, or if you put any word in front of medicine that people don't understand, their interpretation is not the real. And it's unfortunate, but it's true, not the real medicine. Like, that's, if they don't understand it, their judgment is, well, if it was the real medicine, I would have heard of it. And that's when I thought, okay, we're just going to call this the new medicine. It's going to be new, and this is the way that we're going to do it. And ultimately, what we're building is essentially the layers of care that I spoke about before, right? So putting people into these categories, you know, healthy people just get community and education. Tier 2 people get health coach support, and Tier 3 people get referred to the Functional Medicine Network. What we're talking about doing, and what new is sticking that thing on top of the structure that serves the Christian ministries. Because there's 1 million people in these ministries now, there are organizations that we've found that have been servicing these organizations and have scale, right? So, you know, I know one of the concerns is like, how do we know that this thing's going to work? The organization that we're partnering with is currently doing all the services that you get in a Christian ministry for Christian ministry. So that's the health cost sharing. There's like, there's the person that you call to say, hey, I need an MRI, and they're going to tell you which one's the cheapest. There's a range of other services that they provide already to these ministries. There's Teladoc that's included there. If you need a prescription at 3 a.m, you know, you can get a doctor. You don't know who that doctor is. You'll never see them again, but they can send your prescription to Walgreens in a minute. So that's included. So they provide a chassis of a health plan that's essentially equivalent to a Christian ministry. And then we just stick our care on top, and our care being, you know, the health coaches on the phone, and then this network of providers that are contracted with us, that we will say, okay, you need a functional medicine doctor. You're in Raleigh, North Carolina. Here's the 3 closest to you. This is what they charge. Go to them, pay the cash rate, and submit for reimbursement. So basically, how the system will work is that any one-off doctor visit, you go, you pay the doctor the cash rate, and you submit for reimbursement. Anything more than a doctor's visit, so anything acute, anything severely chronic, any sort of like emergency situation, any sort of like more complex thing, you call up the people who have been doing this already for 30 years, and you say, hey, you know, I've had this thing come up, you know, and they'll guide you to other health services. But ultimately, our thesis is that if we can keep people well with our layer of care on top, we can basically reduce entry to the whole rest of the system, which is where all the money gets sucked in. So what we're building is something that has scale and it already develops, and then putting our care on top. So the new Vision Tour is really all about getting people ready, particularly the provider network, for this to happen, because we hope to develop a ton of new patients. You know, going back to our thesis, like, our thesis is this next 45% won't come because we tell them that functional medicine is better. They're going to come because the insurance that they get, the alternative to insurance, like the sharing economy, is happening in every other industry. Cars, houses, anything. And this is the sharing economy, and it's only reached Christians up until now. And because it's got a Christian exemption, it hasn't reached the number of people that it could reach. Our goal is to bring that to a lot more people. This next 45% will sign up for our thing because it's going to be significantly cheaper, anywhere from 30 to 70% cheaper, depending on whether you're a family or whatever. And then the care that they get will be functional medicine. Because I saw something the other day, 88% of people, if they've experienced functional medicine, prefer it, right? They just want it. So are we going to spend our lives convincing people that they need it? Or are we just going to create our own healthcare ecosystem where we can control the order of care and just put it at the front, not at the back, not waiting until people are like ghastly ill and then you're the last resort, but by, going upstream. So that's sort of like the thesis. I'm literally living in a bus with my family. Tonight is the first night that I'm going to sleep in a king-size bed with no one else because I'm at this hotel in San Diego. And, I'm coming to North Carolina. And I'm not, let me tell you this, I'm not relying on you guys to fill the community, right? I'm here at this event today because I've got already like 100 health celebrities, from Deepak to Instagram models with millions of followers, of young people. We want young, healthy people in the pool. So I've been spending my time getting those people. These people are going to be in our pool, right? As well as all kinds of other people. And ultimately, what I want to do is put them in the pool. And the reason for the tour is to get ready so that when we launch in North Carolina, we have 20 doctors who are willing to do functional medicine telemedicine sessions at their own cash rate or at $300 an hour, depending on how that's working out. It'll just be a one-off payment. It's not going to be like a package of care. But ultimately, the reason I think this is going to serve a number of purposes. One, more demand to functional medicine. And two, I want to create opportunities to practice functional medicine for those doctors who feel a moral obligation to practice this type of medicine, but for reasons valid or historical or in their head, will never make the jump into private practice, right? It is not the way of the world right now to be jumping into private practice. If anything, everyone's going the other way. And so I know that there are lots of doctors out there who would love to practice functional medicine if there was a job doing it. And ultimately, we feel like in that next 45%, for this to go for the next level, we have to go beyond the pioneers. The pioneers got us here. The pioneers got us to a point where it was done, where the medical boards were kind of off our back finally, where people were seeing that this stuff works. You've taken the arrows in the back. What I hope to be able to provide for the community is just sort of a vision for actually getting this care to the front of healthcare. And the biggest reason why I think this is the plan that has to happen is that we don't have to ask anyone's permission to do it, right? We like the law has changed. Like, people are here. There's a thing tonight, meeting with Congressman Tim Ryan, who's like wants to get the yoga vote out to his crew. The plans that he's talking about are like on a 10-year trajectory, hoping that Democrats get some power back or whatever, because he's a Democratic senator. Like, who wants to wait for that? I've got a little bit of a libertarian streak in me, and I just want to do it. And I know that there's a lot of practitioners and community members and people out there. So that's my spiel. I'm happy to answer any questions for you. I really appreciate the opportunity to connect with you. I do love North Carolina. My father-in-law used to live in Black Mountain. I've spent some time there. I do love the people, and I'm really looking forward to being there. We're not going to have that much time to spend because we're doing like these events back to back, but I would love to meet all of you at the events and have an opportunity to not only share a little bit more about the vision, but also to showcase the local provided talent that's in North Carolina. So that's my spiel, and I'd love to take questions.
That's a lot of passion. So I'm gonna unmute people.
See you later.
Does anybody have any questions?
Deb, can I ask one? Could you hear me, Dad?
Go ahead, Michael.
I've been transitioning now to packages, and it's hard for me to imagine going back to treating that third tier with a kind of episodic care that it sounds like you're talking about. Could you hear the question?
I did, yeah. Look, I mean, if you're a functional medicine doctor that has been able to make it in the package world, like Dr. Deborah Matthew here, that's amazing. Well done. And I don't need to continue to do anything else. You should just carry on doing that, or otherwise. You know, it's a fairly unique doctor that actually can pull that off. It's not easy. Like all the things that you've had to learn how to do. I just see that the failure rate of doctors who try and go in that direction can be quite high if they don't have the right support systems for them. And so if you've been able to do that, and if you're making a great living doing it, I would just say continue going forward at it. We can't really, I don't have enough control of the situation at this moment to know, you know, over time, we're going to develop data to show that preventions cause long-term reduction in costs. And so then we'll be able to have more flexibility. But at the beginning, we kind of have to play by the rules of the organization that we're partnering with. And so we have to do appointments. But all of our members will have that health coach. You know, one of the things we've seen is that it's really powerful for people to have a really strong ongoing relationship with someone they know. But I really don't think that on a bigger scale, if you're trying to scale up functional medicine, I don't think that relationship can be with a doctor because there's just not enough of them. They're too expensive. And so, you know, so the reason why we've created our system the way we have is that we give a lower cost provider the real like coaching connection role. And the doctor is really there for the root cause diagnostics and the sort of working up to the highest level of, you know, of your ability. And so that's just the way that we've set up the model. So I would say if you have built a practice doing packages, well done, and it's amazing. And I hope that through our work we'll be able to increase the interest in functional medicine, so you'll continue to be able to make a great living. It just can't be done in the system that we're setting up.
One of the key components of the packages that we sell is a health coach.
That's great.
And it seems like the optimum way to arrange that would to be integrate the care of the functional medicine, this third tier, with the second tier in some intimate way, so that they're not just you know, not connected.
Yeah, sorry. When I said that, so in the three tiers, the third tier definitely has the coaching too, but it just actually adds the doctor in as well, and some of the root cause diagnostics that aren't included generally. So
thank you. Yep.
So I have a question with that. So in a package, typically, you know, there are a certain number of doctor visits in there. So there's all sorts of different things included. So there's, you know, built in, there's a charge for the office visit. It's just built in. And so
Deb, we can't hear you. I think you have to mute everybody again and then just unmute the person that talks.
Okay.
yeah, no,
Can you hear me now? Go like this if you can hear me now. Okay.
I'll just paraphrase the question. So Deb was saying, like, sometimes she's provided basically a super bill, right, for patients. So yeah, I mean, look, you can, in this first iteration, I'm not going to be the guy that's deciding whether or not these claims get paid or not. Like, there's going to be, all of the members will have an app and they can take a picture and submit it just like that. The cool thing is that, you know, most of these claims will be approved, but then it's just like there's an unshared amount, which is equivalent to a deductible that you'll be, you know, building up towards. So, you know, so in that, I would say, like, you can still do that and they can still submit it. I just know, like, I know what I can control and what I can't. And what we're basically controlling is just the functional medicine delivery. All the other emergency care stuff, the teledoc, all of that stuff is being done by an organization that currently delivers that to over 1 million people. And so they have their own rules and specifics. Now down the road, once we've got more than 10,000 people in and we can have our own things separate from that, we can make a lot more decisions. But ultimately, you know, I think we all hope and we all sort of like intuit that functional medicine will save money in the long run by keeping people well. We're gonna develop the data that will prove that out one way or the other.
And in my personal experience, the people who have the Christian Health Share, when they come to see me with a program, they get the best reimbursement. So even though what I do isn't exactly what the insurance is sort of set up to cover, I don't think it will be a detriment. I think that if somebody wanted to come and see me, that having that potentially could get them better reimbursement than if they have Blue Cross Blue Shield, for which, you know, they probably won't get anything back.
And bear in mind this as well, is that, like, you know, when I switched, I went from $1,500 a month for a family of 3 to $449 a month. So I was saving $1,100 a month, you know, over and above. If you sell me a $2,500 package, that's a 3-month package, and I'm what that, like, my wallet share just went up. And the reason I mention this is not because of like historical trend, but if you've been following the news, Trump is withholding money that was promised under the ACA to the insurance companies. And what that means is the insurance company is going to fight back by raising the rates even more. So I expect in October you guys will be fielding a lot of anger and questions from patients whose thing just doubled. In Arizona last year, it doubled, right? It doubled. No one's got money for that. It's going to be crazy. And we hope that when the red and the blue are, you know, sparring, the green can just come right down the middle. Anyway, I'll unmute everyone. Any other questions?
Hey, James, this is Bethany. Yeah. Hey, James. This is Bethany Sprague. I'm one of the meetup hosts in the Charlotte area. So huge fan. Thank you so much for coming to the Charlotte area. And you've got a whole group of people that are looking forward to meeting you. My question is about the provider aspect. How are you guys fielding the providers that you're going to get within your network?
So, you know, thus far, part of, we'll see on the tour, you know, yeah, I can mute everyone again. So, yeah, so part of what we're doing is just recruiting people in. So far, like coaches, we had 2,000 coaches sign up on the first time that we said, okay, we're going to be hiring coaches. On the doctor side, you know, we've had people opt in to the new PPO network, basically. And we have only reached out to the doctors that we've needed when we've signed an employer in this first iteration that we've been doing in employer health. So most people have not been in touch, but ultimately, okay, we've got 10 minutes left. Ultimately, you know, it's a question of, so far it's been an application, and then it's been connecting with our Chief Medical Officer, Jeffrey Glad, to sort of vet the clinic and find out. Ultimately, what we're looking for is like, you know, lifestyle-driven root cause resolution chronic disease. I know a lot of functional medicine clinics are like Lyme clinics or toxin clinics or mold clinics or otherwise. And so we've early on, we've looked for MD, DO, NP, and ND sometimes in the States they're licensed, but MD, DO, NP, you have to be licensed to practice medicine. And then we've been looking for doctors that are trained appropriately and experienced in doing the kind of care I was talking about. I think there might be Sheila at the door.
Oh, sure.
Okay.
You want some more?
We're live. We're live.
Do you want more?
Come on in.
beer?
Did that answer, oops. Did that answer your question, Bethany?
Should we come on? How are you?
I'm good.
Yes, it did. Thank you.
Sheila Kilban is in the house.
Hello.
It's yeah, we got about 7 minutes left. Let's have some more. Thank you for the questions.
I don't think they can hear us.
Oh, Laura Black. Hello.
Hello, Sheila.
I was just texting her. Will we see you again?
You said you were out of town. I didn't know you were there.
Well, here I am, asking to share receipts. Look, she's coming to pick up my padlock, like the little device that shocks your wrist.
We're gonna see if it will cure the boys of their fingernail biting and then maybe sugar.
There you go.
What do you think?
It does work, just don't jump in a swimming pool.
Don't what?
It's not designed for swimming pool use.
No, not good.
All right, any other questions?
Okay, I couldn't hear you.
Ultimately, before these events, we're going to be doing sort of like the local providers to come. There's like a VIP drinks and whatever. So that's a time when you guys can come down, ask questions. At this moment, we had hoped to be ready for like November 1st for open enrollment. It's proving a little bit more time consuming and detailed than I had hoped. And I'm not really the detail guy, so surprise, surprise. But we've got the best people on it. But ultimately, yeah, we're really excited to be coming through. And as I said, this is really a tour to prepare the provider network and to let them know what we're doing, to get everyone organized so that if we do launch and we end up with like a couple thousand people in North Carolina, and out of those couple thousand, 5% of them need to go to a functional medicine doctor, that, then that 50 to 100 people will have places to go that are either close to them or available via telemedicine, where there's licensed and reputable providers ready to service those people. And when those people show up, they will already know about lifestyle. They will already be doing the eating and all those other things. That will be a happen. So you could just really focus in on the root cause diagnostics, spending time with people. Ultimately, we need the physician network because, if you're going to get people off drugs, someone has to someone has to take them off the drugs. And so that's why, we hope that there'll be a mixture of cases, some of which are like, hey, my hemoglobin A1C has come down so much that I can come off my metformin. And then some will be like, hey, I've been having these symptoms and I've been doing the lifestyle, but I haven't been getting to the root cause. Let's dive deep and go into the history and maybe do some other diagnostic stuff there.
Well, I was just going to say, the other thing I think that's so powerful is that when we, like the North Carolina Integrative Medical Society, to know everyone, because I get asked all the time for people who want to see adult integrative or functional medicine doctors. And so to have that network is hugely powerful, and the families love it because they want to know where to go. And this is it's a further way to keep building that network and having patients pre-educated. We all know how that makes our job so much easier.
And the more people who experience functional medicine, the more people will want to experience functional medicine, and the more people will need practitioners.
Yeah, well, here's the thing. Look, there's 150 million Americans who will never buy this thing because they have employer insurance. They're not going to buy another health share on top of it. So those people are still just going to be, there's going to be way more of them that are going to be educated, and they're going to want this, and they're going to pay for it over and above their employer insurance that they get. So there's a good chunk of the population. That chunk is going down as the gig economy whatever grows, but that chunk of the population is not going anywhere. That chunk of the population is probably going to be more likely to come in your offices, and you can see them exactly the way that you operate right now. We're just trying to move the needle on particularly young people, right? Young people, that health cost sharing is popular with younger people, and we want to try and get those younger people into functional lifestyle medicine early on. And this, I believe that what we have at this moment is kind of like a glitch in the matrix, where we can have something that includes all the best care and is cheaper, and will bring that next group of people to the table. And once they experience this type of care, they won't go back, right? They're not going to go back to another doctor that doesn't understand how lifestyle affects health if they've had an experience of one that does. So let's just give many more people that experience. And that's good plan.
So the dates are October the 8th in Raleigh and October the 9th in Charlotte.
Correct. We may do a very small thing in Asheville on the 10th, but it's not going to be a whole event. It's not going to be a PowerPoint. It's just going to be sort of like a get together, maybe like a dinner. But if you are in Asheville and you're thinking of coming to Charlotte, yeah, sure.
Absolutely.
Sheila will be there.
And would you want us to use our networks to advertise this?
Yeah, absolutely. So if you go to newhealth.com/tour, or if you go to goevomed.com/tour, we have free tickets to anyone who wants to come down. So you can put in for practitioners. You can use the code Dutch, DUTCH capital D, and you can get free practitioner tickets, and you can give that to your patients too. So you're more than welcome to promote it. Typically, we've seen that there's just a lot of, consumers and patients out there that have been sort of waiting for something like this. And that's what we've heard so far through the tour. It's like, thank you for trying to put this together, because, as we started at the beginning, like the patient that has gone above and beyond time and time again to end up in one of your offices is like quite a resilient person. And so, we're trying to create